For the Daily and Princetonian, I'm Katie Tam. With us today is Princeton Health Officer Jeffery Grosser. Dr. Grosser, thank you so much for joining us.
Katie, thank you for having me.
So I guess to start off, initially New Jersey has been was a huge hotspot for the coronavirus. But in the past week, it seems like recent reports have shown that COVID-19 case numbers have been declining. And I was wondering what the trend has been like in Princeton.
In Princeton, we've certainly seen a slowdown in the incidence of COVID-19. Our peak for COVID-19 incidence was really occurring in early to mid-April. And we started to see some really good trends late April through Princeton in particular. What Princeton has a benefit of is its proximity to New York and Philadelphia, but in the case of this pandemic, we've seen it's also had other results with regards to more migration of cases, especially occupationally related. So we had some things we had to combat from the early onset of this, and Princeton also had some of the similar trends with long-term care centers having some outbreaks here as well that we had to battle through to make sure that we were in a good position to recover from.
And what is the state of testing like in Princeton? I was reading about this sort of self-swab test that people could pick up at like pharmacies like CVS, and I was wondering if you could tell us a little bit more about that.
Yeah, so testing's come a long way. I mean, if you think about where we were about 2.5 months ago, there was only certain healthcare facilities that had access to a diagnostic test. And now we're seeing primary care physicians, urgent cares, and many of our major pharmacies also have access to both the diagnostic test as well as the serological test, which tells you if you have antibodies against COVID-19. So in Princeton, we have not had a tremendous difficulty in getting residents to and other individuals that work here get tested. We've actually been pretty fortunate that the locations around us, both with Rutgers creating the first saliva-based test, and then also with some of the healthcare facilities here that are really regional leaders with regards to their own access to medical technology, we've been very fortunate to get people tested. Now, what we've seen, and it's been pretty trying in the early onset of COVID-19, was not necessarily the ability to get tested, it was the ability to get results back. A lot of these laboratories that are performing these tests have significant backlog, whether it's in the actual testing or it's in the reporting of those tests back to local health. And what that does is it really hurts contact tracing, which I'm sure we'll probably talk about a little bit. But the reason why it hurts contact tracing is that the incubation period or the time frame from being exposed to the period of being symptomatic is anywhere from 1 to 14 days or so with COVID-19. So if somebody gets tested in the middle of that incubation period and doesn't get results back for a week, they may be outside of their period of both incubation, but then also even their potential to spread it to anyone else. So we don't have the ability to put our eyes on these individuals if the testing is backlogged. So COVID-19 definitely had a deficiency with regards to how quickly these tests were turned around, which is why the new tests coming out that can get results back in hours or a day are so important to the ongoing effort to try to combat this thing.
And so last week in a press briefing, Governor Murphy sort of discussed reopening plans for the state, and I was wondering what the road to reopening looked like in Princeton.
So in Princeton, we're following the governor's principles in order to get back. What we've found is that some of the things we wanted to make sure were in place needed to be in place before we really reopened too much, and some of those things include adequate number of contact tracers to track down individuals that were potentially exposed to COVID-19 individuals in Princeton. So we did expand our contact tracers in Princeton. Right now, we have 12 individuals made up of both volunteers, other municipal workforce, health department staff, and Princeton School District nurses who have been assisting us with contact tracing and trying to suppress any other potential exposures from confirmed COVID patients. The other thing that we wanted to make sure was available was testing. So we wanted to make sure that people had access to testing, but both knew where to go get tested. And now that has kind of taken care of itself with regards to what Governor Murphy has pushed forward with the removal of the need to have a prescription to get a COVID-19 test. This allowed a lot of these major pharmacies to be able to do this testing. And it also improved some of the test results that we started to see come in, because individuals were also able to go get tested if they were from a potentially high-risk group, but not necessarily symptomatic. So we started to see more individuals coming back negative, which gives us a clearer picture of kind of how the disease is working through the community. So we are following Governor Murphy's principles with regards to the roadmap back. The unfortunate part is that Princeton's still at the discretion of obviously how quickly these test results come back in, and then also the executive orders and how the community manages to cope with those things. And we're fortunate in Princeton that the greater community has done a really good job of abiding by the stay-at-home order and social distancing efforts and masking. However, we're going to come to a point where things start to get reopened. And the fear, of course, is as you start to reopen, cases start to increase and you start to have these concentrated outbreaks. Without the right things in place, those outbreaks could become more widespread.
I also wanted to return to some of the things we talked about earlier in terms of contact tracing and testing. So you mentioned that there's you said there were like 12 volunteers or workers who are doing the contact tracing. I was wondering what New Jersey is doing in terms of like expanding the contact tracing workforce and what is involved in terms of like training them, and if it's like paid workers or volunteers, that sort of distinction.
That's a great point. So the Governor Murphy, part of his principles to return back is obviously the expansion of contact tracing. So as I mentioned before, Princeton's taking those policies and trying to translate them into local action. That's why we ramped up the number of contact tracers locally. Mayor Lempert, the mayor of Princeton, and our Board of Health Chair, Dr. George D. Fernando, were very supportive over us as a town putting together every resource possible to improve the number of contact tracers. Prior to COVID-19, we had about 1.5 individuals that were doing contact tracing. Now we're up to 12. And the reason for that is based upon a model put forth by Johns Hopkins University Center for Health Security, and they put together a ratio in particular to the number of individuals in a population of a town and how many contact tracers you should have. So for Princeton, we fit in right around that 9 or 10 around 9 or 10 contact tracers for the size of our population, which is about 31,000 people. So 12, we're a little bit more than that, but it gives us some leeway in terms of scheduling. The state, however, has the plan of, and this is from what we've learned through the state health department, they will be hiring a, quote, army of contact tracers to be utilized in a surge capacity form of, I guess, support for local health to use. Now, these individuals I don't believe have been hired yet, but they will be hired and paid. I believe they're going to be regionalized for the parts of New Jersey, south, central, and north. And from my understanding is that if local health needs assistance with, as I mentioned before, clusters of cases, you could call upon these individuals to assist you. Obviously in Princeton, it's difficult, and really any other town, it's difficult to just jump into a contact tracing team. You kind of need to know the lay of the land and the community and the health department. So it helps to have these individuals already in place. So whether or not we'll call upon those individuals really depends on the incidence of COVID-19 and the resurgence that is expected in the fall and winter. That being said, having that extra support and security is really important to us to make sure we are aware of it as well.
And you also mentioned nursing homes and sort of those being like centers of COVID-19. And I think I was reading a report like earlier in April that authorities discovered like 17 bodies were piled inside a nursing home somewhere in Sussex County, which was pretty horrifying. And I was wondering what Princeton has been doing to keep the residents of nursing homes safe in particular.
Yeah, that's a great point. And yeah, COVID-19 unfortunately has drastically impacted long-term care centers in New Jersey and New York in particular. what we've been doing locally is obviously constant communication with the directors of these facilities is important, because things at these locations was changing very quickly all the way back to mid-March. In mid-March, the New Jersey Department of Health put a ban on all non-essential visitation to these locations, and then subsequently put forth universal masking for all individuals that worked inside of these facilities, because at that point we began to see kind of evidence of asymptomatic spread, which is really difficult to control. The only measure that we had in place prior to that was cohorting of the long-term care centers, where you would basically separate the well from the exposed to the infected. And the idea is, if you could separate the residents or patients and then separate the staff that work on those individuals, you could essentially have 3 different groups that you could focus in on and try to protect. Now, it was up until, I believe it was May 26th, that the state required the testing of all staff and residents of these institutions. That was a really good move, because then you could start with a baseline of, this is what we've got going on. Prior to this, long-term care centers were only testing individuals if they were symptomatic. Certain facilities began to test everyone, but it wasn't until the executive director to test every individual. Fortunately, we were a little bit ahead of the curve in having these discussions with the long-term care centers to make sure that they begin more widespread testing. Now, this was a catch-22. If you test all staff, you might have a number of staff that are infected that now need to isolate and can't work. And clearly there was a shortage of long-term care center workers. As crazy as it sounds, unfortunately, there was a period of time where there was such a shortage of healthcare workers and long-term care workers that if you were COVID positive, there was discussion over having these individuals continue to work with COVID-infected patients, because there was just a shortage of individuals. Unfortunately, that was something that, as a result of the shortage of workforce, some of these facilities not testing, there was some bad consequences as a result of that. In Princeton, we have 3 facilities, 2 of which were experiencing outbreaks. They both did a very good job of the cohorting, which takes some time to have positive impact. But in all, when they went through and they did the required testing, only 2 individuals after the required testing came back positive after all of that. So they were very fortunate in that the majority of the outbreak was being controlled by them before this was even mandated. So they did a very good job there. But that being said, unfortunately, COVID-19, when it impacts our older adult population, especially individuals with pre-existing conditions, it has drastic effects. And unfortunately, that's exactly what we saw in long-term care centers. And again, another unfortunate piece is that local health departments really we do not have regulatory oversight of long-term care centers. We don't license them, we don't inspect them. So the reason why local health departments are responsible for outbreak response is because we're responsible for outbreak response in every other facility. So that was our foot in the door. But for many of us health officers and local health departments, we didn't have anything to go off of in terms of a historical guidance document for what these places should be doing.
And all of us are thinking about what fall semester at Princeton will look like. What kind of factors do you think colleges and universities need to consider in planning for the upcoming academic year?
Yeah, it's a great question, Katie. I think, colleges and universities obviously have, one of the hardest things to figure out, which is, trying to make sure that the health and safety of both faculty and students is protected. And, if there's any risk of jeopardizing safety for health or life safety for individuals, a lot of colleges and universities are weighing that out, whether or not that they can drastically reduce that risk of an outbreak because clearly, although the age of the population of students in most colleges and universities, is in that 18 to 22, graduate school up to 26, and obviously extended degrees a little bit older. But that population is not necessarily the population we're seeing these severe health complications within COVID-19. That being said, faculty may be a little bit older. They might fall under the older adult population subgroup. So how do you protect them? And these are questions that colleges and universities are putting together. We work very closely with Princeton University and their Office of Environmental Health and Safety and Princeton Public Safety in terms of putting together plans that benefit both the community and then also the university. So we're working very closely with them to make sure that we've really hit all points on how to make sure that people are as safe as possible when they return back. Now, when they return back really depends on what happens not only as the town of Princeton and the state of New Jersey and even the United States, really worldwide. Obviously when this started, the Princeton Health Department was tasked by the State Health Department and the Centers for Disease Control with tracking and doing contact tracing on individuals returning back from Wuhan, China. Now, things are drastically different. Now, people from the United States are being tracked in other countries because they're leaving an area with an ongoing pandemic. What we're going to see in September is a ways away, but I understand that schools need to start making these decisions now. And the way I see it is, if things do return back to some sense of normalcy in September for colleges and universities, it's going to look drastically different. There's going to be limited class sizes. There's going to be, different social distancing techniques in place. There's going to be, an urge to have online classes, even if you're back at school. So, I know the decision has not been made yet for Princeton University to have individuals return back for the fall semester. However, there's going to be a number of different things in place, I believe, when in fact that does happen.